In Malawi, MMS in pregnant women would help to achieve good pregnancy outcomes. And in Malawi, good pregnancy outcomes are mainly in the areas of good birth weight, not low childbirth weight, and also help us to end high levels of issues of preterm birth among children, as well as anemia among women and children. I've learned a lot from the meeting. We appreciate whatever other countries have so far done in as far as MMS programming is concerned. So as we go back to our country, we will scale up whatever we are doing. Apparently, we are still at the level of engaging the consultants to do the formative studies, as well as implementation research. And the other countries are already ahead of us. So issues of supply chain, issues of good coordination, among other issues from the meeting, will help us to improve on MMS programming in the country. I think the first action as we go back to the country would call for the MMS task force meeting, and in that meeting we'll discuss on the new roadmap to incorporate the recommendations that have come from this meeting. For instance, we are expecting the first consignment of MMS in January next year. But before the consignment is in the country, we would make sure that all the groundwork is done. So we'll do the preparation as well as the awareness meetings, CSBCs, and everything that is necessary to be done. We'll do that before the first consignment. The technical part of it, we have learned a lot in terms of the technical knowledge, and at the same time, the experiences, the knowledge, the attitudes, and the practices. Now, in our country, Malawi, we have agreed as a country to start with 5 districts as pilot districts out of the 29 districts. Now, as we start the piloting in the 5 districts, we would make sure that the experiences that other countries have so far experienced would utilize the solutions from their challenges, and as well as seek more technical support where necessary from the right countries, as well as right teams that we have seen here. There's a team from Micronutrient Forum. There's a team from the finance, the CIF, among others, and there's also a team from the supply chain, among other teams. So should we have any challenges in the country, we should be able to link with the right authorities. Malawi was privileged to be part of those which attended the July 2023 meeting in Ethiopia, and it is from that meeting that we had to kickstart the actual MMS on the ground. Apparently, as soon as we finished that meeting, we had to engage the right government sectors as well as non-governmental organizations to support, to have the buy-in. And because of the evidence that was generated from the last year's meeting in Ethiopia, organized by the institution, we ended up having a lot of buy-in from a lot of stakeholders. And because of that, we started now working on the documents. So we have new posters, SBCC's posters. We also have made changes on the NCC materials, among other materials. And next week, we are also meeting to work on the micronutrient strategy, just to align with what we learned in the last year's meeting in Ethiopia. We want more technical support, considering the fact that we want to have a lot of evidence from other countries. At the same time, I would also love to generate our own evidence at country level. So automatically, we will need the technical support. Apart from that, we would also need support in terms of finances, so that we can finance the piloting we can finance the studies that we want to do in the country, including part of the formative studies. We want a lot of financing in that area. And at the same time, we just also would love to have a good engagement with you, so that by the end of the day, we should not be offside. We should be able to do the MMS, or to implement MMS within the guidelines of the global standards, as well as how our other countries are also doing.